Assessment. Have to inspect the stoma for color, texture, and length of time in place and tenderness. And then we also have to inspect the condition of the skin surrounding the stoma for any redness or swelling. And then we have to measure the dimensions of the stoma before obtaining an ostomy appliance system from the central supply. So ano po, sakto po dun sa stoma bag. Assemble all equipments and supplies. 1. Clean washcloth, clean tap water, appropriate drainable ostomy appliance, scissors, clean gloves, calibrates container with 500 to 1000 ml of tepid water, caraya powder, bedpan, irrigator tube cone with backflow device, adhesive tape, Kelly pad, irrigation sleeve or belt, with belt. Implementation. Okay po. Ako po si Nurse Eloise. You can call me Nurse L. Okay? LL. Okay. Kamusta ka ngayon?
Okay lang po.
Okay. Tangin ko lang yung pangalan mo, ha? Ano po pangalan?
Princess po.
Okay, Princess. Can I call you Princess? Okay. Wait lang po, Ang gagawin po natin is, Princess, may lalagyan lang po kasi saan po, yung dito na pang susan nyo. And then, konting linis lang po. Okay lang po ba yun? Okay. Explain the procedure to alleviate anxiety and gain the cooperation of the patient. And then, we have to close the curtains for the client's privacy po. And then, we also have to wash our hands and then wear gloves. And for us to prevent microorganisms or infection that we may transmit to the client. So, assuming po na naghugas na po ako, so we are going to wear a gloves po. And then, we also have to place a pad under the client's abdomen for us to prevent soil age. Can you be here? Okay. Assuming na lang po, naka-sideline na po yung pasyente. Pero, isupay na lang po natin po para po makita po sa video. And then, we also have to hang the irrigator with 500 to 1000 ml of water about 12 to 18 inches from the client. And then, we also have to prime the tubing and the clamp. Reutilize po. And then, we have to lubricate our finger for us to easily insert our finger to the stoma side. And then, as you can see, yan, nilulubricate ko po. And then, assuming na nakakapasok po yung finger ko dun sa stoma. Yan. Para po makapasok din po yung And then, attach the cone to the irrigating tube. And then, we can also cut at the bottom of the colostomy bag for us to directly flow the watery stool into the kidney basin. Or we can also clip it. Kasi po meron din pong clip para po doon po nakastack yung stool. Also have to prime the tubing and open clamp for 10 to 15 minutes to irrigate the stoma. And priming the tube allows removal of air, thus preventing discomfort.
Kita.
And then, remove the appliance gently after po. Yan. And then, we can rinse the site with soap and water and then dry using the gauze. And then, apply Caraya powder, and then apply new appliance smoothly and hold firmly for 1 to 3 minutes. And then, apply for hypoallergic tape and needed of the edges of the pouch. And then, dispose the materials that is used. We can also reuse the the colostomy bag. And then we also have to assess the stoma side for after the procedure to determine if there's any changes that may require referral and appropriate nursing management. Document all the findings, and then we also have to document the client's response to the procedure. Okay, princess. Okay naman po ba? Ano pong nararamdaman?
Okay lang po.
Wala naman pong masakit or anything.
Wala po.
Komportable naman po? Okay. Iwan ko lang po kayo saglit ha. Babalik lang po ako. Okay lang po ba yan?
Opo.
Okay.